Hi everybody. I wanted to talk about disc bulges and disc herniations. These are terms that a lot of people throw around because they've been told they have them after having an MRI of their spine, but they really don't know what they mean. And they're not synonymous with pain, and we don't even know how they develop. So let's talk about all those pieces together. A disc bulge is different than a disc herniation. So if we look at our spine, our intervertebral discs are in between each vertebra, okay? And I describe them a lot like two different things in our worlds, sponges and jelly donuts. So sponges at the fact that they absorb fluid when they're squeezed and compressed. And if we don't squeeze and compress them in the presence of fluid, they dry out, get hard, they start to crack, and that can lead to problems like disc herniations. The good thing about our discs and like sponges is if we drop them in water, we squeeze them a couple times, they come back to life. So they're not hard anymore. They're more flexible, more pliable. There's not so much or such big gaps in between the holes of the sponge. So that's number one. What we need our discs to do are move, flex, and pump so fluid can come in and out. Okay? Number two, our discs are like donuts. More importantly, filled donuts. So we have a tough fibrous ring around the outside. Shout out to Kelly's Bakery, by the way, Hamilton, Ohio. So tough fibrous ring around the outside, inside jelly, liquidy type center. So if we think about our disc in between vertebra number 1 and vertebra number 2, as our spine moves and flexes, that disc gets pumped full of fluid. What happens over time is when we don't pump and flex our spine, it starts to crack along the outside, and it starts to be vulnerable to specific movements, especially things like bending, twisting, lifting, because we're putting pressure on that disc that's cracked. Okay, so if we imagine this crack in the backside where they put the jelly in, that's a crack in our disc, and we just keep compressing, compressing, compressing. Do you see how that jelly comes out of the back? That's a disc herniation. That jelly center of the disc, or in this case the donut, squeezed out the back, and now that puts pressure on your spinal cord, your nerves, and can cause very intense pain, even burning electric shock type sensations. So, takeaways from this video. We have jelly donuts in our back, and they're also like sponges. What we need to do is move and flex the spine. In a lot of patients, we don't have that mobility because we haven't used it in so long. And that's where I come in. So my goal isn't to treat you forever, the rest of your life. It's to help maintain a flexible, movable spine so that we don't have cracks, we don't have damage to those discs, so we're less likely to have a herniation or bulge. Thanks, guys.